respiratory syndrome coronavirus 2, SARS-CoV-2. The novel virus was first identified from an outbreak in Wuhan, China in December 2019. Attempts to contain it failed. The virus quickly spread to other areas of Asia, including Malaysia.
The World Health Organization (WHO) has declared the outbreak of public health emergency of international on 30 January 2020 and the pandemic started on 11 March 2020.
As of 27 October 2022, the pandemic had caused more than 629 million confirmed cases and 6.58 million confirmed deaths, making one of the death lists of history. In Malaysia, the Ministry of Health reported around 4.9 million confirmed cases with more than 36,000 confirmed deaths from the virus, showing that we are still battling against this virus. Thus, the employer's COVID-19 response plan should utilize the hierarchy of control, which generally labels apparatus control in the following order from the most to the least effective, which are elimination, substitution, engineering control, administrative control, and PPE.
The video shows that ad hoc committee meetings on COVID-19 was held by the high authority. The committee will hold a regular meeting to deliver its mandate to exercise oversight over the work of the regional exercise authority as it responds to the COVID-19 pandemic, including the work of any regional department, state, regional organ or regional entity involvement in activities to deal with the pandemic. On 4 November 2020, Director General of Health Tan Sri Dr. Noor Hisham Abdullah spoke during a press conference in Putrajaya. The Ministry of Health has detected the emergence of 10 new clusters of COVID-19 in the country. Press conference will be held every day to ensure that all the information is up to date for all the citizens. This is the closure of Malaysia's border with neighboring countries, namely Malaysian-Thailand and Malaysian-Singapore border. There are no more crossing the country is allowed during the pandemic.
Next, we move to the second phase, which is substitution. Substitution means the phase in which we replace the hazards with something safer. Simple word, alternative, to minimize the risk. In this COVID-19 pandemic cases, the government or high authority in the nation will open the country border for the business purpose or any specific purpose only, but in safer strategies. The yearly guidelines that have been made include the citizens need to get for a second dose of vaccination. Temperature scanner will be put in every closed place, such as hall, shop, shopping malls, classes, or Kulliyyah auditorium to check for early signs of fever, as we know that fever is one of the COVID-19 symptoms. To add on, in this phase of hierarchy, the high management can also execute a new norm in the workplace, such as work from home, depending on the nature of work. We, nurses, as a healthcare provider, working in a healthcare setting is compulsory for us. While education, students will be introduced to online learning method for a new norm to minimize the spread of COVID-19.
The third stage was engineering control. In this stage, we reduce or prevent hazard from contact with the pupil and healthcare worker by isolation. When the patient develops symptoms such as high fever, sore throat, cough, and difficulty breathing, the patient will be screened at the COVID-19 assessment center, and the nurses will perform a swab test PCR on them. After the result come out, the patient will be transferred to the hospital and placed in an isolation room. All the family members that live together with the patient consider close contact and need to do PCR. The positive patient without symptoms will be sent for the isolation to pusat quarantine and COVID-19 berisiko rendah PKRC. But for the negative patient and asymptomatic, they will be isolated at home and be monitored at home in human surveillance order (HC). The aim of engineering control is to place the barrier between the worker and hazard, the SARS-CoV-2 virus transmitted through the airborne. In the COVID-19 ward, the patient will be placed in negative pressure isolation room, and the healthcare worker need to wear PPE laboratory to avoid direct contact to the patient and shield them from the virus.
Food and Drug Administration (FDA) is sharing information about best practices to operate retail food stores, restaurant, and delivery services during COVID-19 pandemic to safeguard workers and consumers. For employers, they must do the pre-screen, which is take their temperature, disinfect, clean the workspaces and equipments, and do the regular self-monitoring to assess the signs and symptoms of coronavirus, and they have to wear face mask or face cover, and the last one is they have to practice social distancing, which is about 6 feet from other people. As Malaysian, we still to adhere to RMO, which is Restricted Movement Order. It is necessary to work from home and venture out to buy essential groceries. It is very important to protect yourself from getting or catching the viruses and spreading it. Here are some practices measure and good hygiene practices by Info Sehat. The first one is washing and sanitizing your hands regularly. The second one is avoid touching your eyes, nose and mouth. The third one is practice proper ethics, which is cover your nose and mouth while coughing and sneezing. And the next one is maintain social distancing about 1 meter with other people according to WHO and MOH. Okay, the last one is seek medical care if you have fever, cough and difficulty breathing. COVID-19 pandemic is a huge challenge to education system, and that's resulted in the closure of schools and universities across the world.
Personal protective equipment recommended for as PPE is equipment to minimize exposure to hazard that cause serious workplace injury and illness. This injury and illness may result from contact with chemical, radiological, physical, electrical, mechanical and other workplace hazards. There are 3 distinct levels of PPE worn by healthcare workers. Each category contains type of equipment they should use to perform job tasks based on what they are likely to encounter in a given setting. So, the first level is level 1 PPE. It consists of heat-resistant surgical mask, disposable apron, glove and face shield. This is the lowest level of protection considered minimum risk. A level 1 PPE is designed to be used for basic care and it provides a slight barrier to small amount of fluid penetration. Level 2 PPE consists of N95 mask, glove, eye protection to be worn on wrist assessment or face shield, disposable shoes cover, long sleeve fluid repellent gown and head cover. This level of PPE is used to reduce the risk of transmission of droplet induced. For example, when we handle MRSA and ESBL patient. Level 3 PPE consists of N95 mask, double disposable glove, eye protection, eye shade goggles or face shield, medical protective suit with hood and disposable shoes cover. This type of PPE is for healthcare workers who are involved in aerosol generating procedures such as intubation when an airborne disease is suspected or known. For example, when handling COVID-19 patients. To conclude, the hierarchy of control is a system for controlling risk in the workplace. The hierarchy of control is a step-by-step approach to eliminating or reducing risk, and it ranks risk control from the highest level of protection and reliability through the lowest and least reliable protection.
For the Islamization, we can refer to the Surah Ar-Ra'd verse 11. It means Allah will not change the condition of a people until they change what is in themselves. Meaning that in the face of disaster, Islam holds that humans are not justified to be fatalistic and instead trying to use all the resources that Allah has given to reduce the disaster risk.
Batuk lagi. Ya. Astagfirullah, siapa nasi dah? Ya, aku tahu.
Have is sharing, yeah, which is it.
Yeah.